Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In the Module 2 of the Patient Safety Regulation Accreditation Measures and Standard Treatment Guidelines, we would be discussing on the accreditation part, certification and licensure in the healthcare quality. We have seen the accreditation and certification in the previous chapters where we find how the licensure and accreditation in healthcare quality is different in this today's discussion, where we would be taking the content as accreditation process, certification, licensure, and impact of accreditation and regulations on hospital work processes, impact of licensing and regulation on hospital working process. So what is an accreditation process as? Accreditation process begins by educating staff and creating awareness among themselves and making them more realize what is the importance of training for them part. The foundation of this process is a strong leadership, and the hospital's top people or the top management need to emphasize in the hospital culture what is being seen as an educating their staff as. So the top leaders must make sure the entire hospital team understands the benefit of accreditation, what duties they need to perform, and the timeline for the completion, where we find that only starting is not one scene actually. We need to even see the entire timeline that where the entire education process needs to be taken as. Gap analysis or the baseline assessment, where we need to see before making the changes in the entire organization, the organization must compare its current operation against the official rules to find the weaknesses that we need to work on. Usually, a professional auditor helps identify what resources are missing and sets a schedule for the upcoming inspection. Without this, there is no such as a requirement that the hospital needs to work on. This is called as gap analysis. Or the hospital can see it as a baseline assessment, which is usually done at the very first. There should be an action roadmap that needs to be derived. Using the results from the previous assessment, which I stated as a gap analysis or baseline assessment, the team creates a plan that focuses on the most critical standards first, which are to be assessed first, which are to be seen as to be worked on first. Specific tasks and deadlines are assigned to the right staff members, where we find that the people who are knowing this, who are working on that, only should fix this task. So this strategy works as writing policies, training the employees, and tracking how well the work is being progressing. So this needs to be seen as a strategy that the hospital should work on for the accreditation process. The third part in the accreditation process comes as a mock survey. How does the mock survey help to an hospital? A mock survey is a practice run should happen in 3 or 4 months before the real inspection. You cannot just simply go for the accreditation without this. And this mock survey meant to be helping actually the hospitals in the entire process that can soothe actually the entire process of the accreditation the hospitals goes for. This buffer time is a crucial period because it gives the organization a chance to correct any errors they found during the rehearsal. It is just like a litmus test a person can take to understand what is actually the gap. Then comes the final survey. The final survey success depends on the dedication of everyone who have contributed actually to the success of the organization. That can be administrators, nurses, paramedical staffs, and the physicians. The leaders at the top need to encourage the staff without causing any burnout or removing them or giving them any blame for whatever they are doing in lab. The main goal is to fix the problem and to improve the patient care, rather than not making it more complex. During the final step, the agency auditor inspects the facility. So you need to fix the agency auditor to see that what is need to be inspected at your facility which is being prepared for that part. A committee reviews their findings to decide if the organization qualifies for the accreditation. So there will be a committee which will be called upon, and the committee ideally gets the entire inspection done by the auditor, and then they review it, and then they put their final decision whether they will come up for the accreditation process. If they find that there is a minor issue which exists, and then they will try to go for the accreditation, no, it doesn't happen. The facility needs to fix it up. They will undergo a focus check before getting it approved. What is the maintenance of the accreditation? The story first comes like getting the accreditation, but after getting the accreditation, what does a facility need to really focus on? The facility or the hospital needs to focus on that accreditation has an expiration date, and you need to work on working and meeting actually what needs to go next. To keep the status, the organization must go through a regular re-evaluations. Means like the quality process continues. This follow-up checks ensures the facility continues to follow the rules and improve its system over time. The met target, the working strategies, the hospital needs to see that their facilities encounter all these things. Reporting requirement. So the agencies require organization to submit the data, and it should be continuously done regarding the clinical results and the general management. Both of these areas need not to be fragmented but needs to complement each other. Most importantly, the facility must report incidents, which is very important to be emphasized here, that because the reported incidents are related to patient safety. The more you work on reporting, the lesser you will find the patient safety issues. And the quality of care such as ADR, adverse drug reaction, sentinel events, and all these are very important to report. You need to emphasize and develop a culture on reporting actually the incidences. You need to encourage the employees actually to work on this part, not to blame, not to remove, and work on these burnouts. When this occur, they must explain what is the root cause of this, how it has happened, how we need to prevent all that, and how we will get more benefits if we are working on this. If the agency or hospital believes the explanation is weak, they must visit the site to verify the safety measures and see that whether these safety measures are really actually working or not. Then comes the certification part. We have discussed the certification in the previous, and compared to it, actually we will find what we need to emphasize more into the working process as. So certification is when an official group formally recognizes that a person or a company or a process or a service or the product meets the certain rules. So here the emphasis is more on the rules. It is an official acknowledgement that the required standard has been met, and it is being confirmed by an independent outside inspector. It is not that your person inside the hospital or the organization will give you the certification. It is not that you cannot fetch actually this with the help of the people inside, but yes, it has to become from an outside inspector. So in general term, what it is, both the accreditation and certification involves checking that something needs to be met. Something needs to become as a confirmatory assessment. So assessment is one where you cannot deny. So because of this, the two words are often used as being same. So for quality management system like ISO 9000, certification bodies check the companies, and the accreditation body check the certification bodies also who give them the certification. In healthcare or in the field of education, an accreditation body directly grants accreditation to a hospital or a school. So you need to see that if you have to work for getting an accreditation, you need to fulfill the basic requirements, then work on the specification, and then come up with the final accreditation. For an individual who gets certificate, they usually have to meet the requirements like having a specific education, a skills, or a training or a work experience, which will give them the certification. They must also pass a test, and they need to pay a fee if it is required. To keep the certification, they often have to meet ongoing requirements which is mandated by the organizations, such as taking more tests or completing a certain number of further education classes if it is recalled for. What is next to be discussed in the licensure part? Licensure means government regulation. So it is a formal permission given by an official authority, usually a government office, that allows a person or organization to do something that would otherwise be against the law. Where I would like to cite an example over here, that a license is needed for a doctor to practice medicine, or for a hospital to run its hospital processes, or for a nursing home it is required to continue the nursing activities, or a pharmacy actually to sell the medicine. So licenses are usually permanent but often require the licensor to pay the regular fees or pass the periodic inspections what they really come across for, to keep themselves updated and meet the requirements, to update the standards actually. So the group that issues the license typically sets a specific minimum standards. The more emphasis here is on the minimum standards that the person or the organization who are trying to get this licensure needs to meet before they are allowed to operate. There is a question of halting actually without the license, which becomes a very important part in terms of trust and getting more benefits to see as what is really not to be over there in that particular organization. So by individual license are required for jobs where we find the incompetence could harm the public, such as people like electricians or drivers or elevators, and so a lot of people are only halted because they don't possess the individual licensing. A license is granted after testing a person's skills through a written exam or an oral exam, or even a practical test is needed if though their work really considers them to go through that. Organization licensing for places like hospitals are given after an on-site inspection. The inspection which confirms that they meet the minimum health and safety standards which is to be abided for the people. Keeping this license is essential for a healthcare organization to stay open and for care of the patients. A license is always guaranteed by a government body or an authorized group like a medical or a nursing board which is established actually with the fundamentals to meet this requirement, to come up with the standards of this. It is a very authoritative body actually who tries actually to accomplish the requirement from the organization who is trying to seek this license. So it addresses the basic legal requirements a facility or a professional must meet to regularly or legally operate or to provide a care which is by the country given as a requirement. So what is licensing in healthcare and why do we require it, and what are the reasons that licensing is to be seen as a very serious and concerned topic? Licensing rules apply to buildings and equipments. You can say the infrastructural requirements. The medical staff, that is the healthcare professionals, entirely all. Even for the medicines, we can say drugs and pharmaceuticals. Disease prevention and treatment, where it comes in the domain of disease control and medical care. So licensing standards also cover building and fire safety, which is now a very important issue. Even the safe handling of hazardous waste, which is now being seen through the help of the professionals. Then what is the differentiation between accreditation versus licensing? How does this two make it more clear? Accreditation certification is voluntary. It is based on high standards. I'm saying that we check the infrastructure, we check the processes, we check the outcomes in accreditation, and we give certification which is completely being seen as a voluntary, which is there is no mandate over here. There is no legality actually to be seen and the organizations are not abided to take it. But for improvement, definitely they should try actually to come across taking this accreditation and certification. Where versus in licensing, licensing is only required when We only check the building, resources, people, infrastructure and human resource, which makes them more mandate actually that if though they don't fulfill this, they will not be given as a license. And we also check a small number of other processes which are supporting actually the requirement of licensing. How do they work together? And what is there we find that a hospital or healthcare organization requires this? Accreditation can help the licensing process. So you may find that accreditation is one which can be a very welcoming thing for an organization who are trying to take it. The regulatory authority can sign an MOU with the accrediting body. So this agreement ensures that all the legal rules are met before accreditation is granted. So you may find there are interlinked benefits which is very important for an organization. If a place is accredited this way, the regulatory authority can skip the mandatory inspection. And you may find that it is very easy actually to go through when it is interlinked to be understood. What is the impact of accreditation and regulation on hospital work processes? We would try to emphasize and seeing that accreditation and following regulations greatly change how patients see and they are safe there and how the hospital really works. Where the working is more to be emphasized over here and how the patients are really getting the benefits. So hospitals quality is mostly controlled by regulations and accreditation, and we need to see that accreditation and regulations are one to be seen very hand in hand. So regulation sets the lowest level of quality a hospital must meet, where versus accreditation show the hospital meet the highest level of quality. So regulations and accreditation both are equally important. When a hospital follows both, everyone involving the patient, staff, and entire hospital top authority people and administrators, they can be sure that the hospitals work and they are resulting in a good way that can meet the healthy outcome. Good quality care is the basis for patient safety. You can find the entire foundation of quality of care lies into patient safety. Therefore, hospital must always check their work and results to keep quality because hospital is an area or a gamut which is very unprecedented to seek lot of patients casualties. So accreditation ensures hospital meet high standards and are always trying to improve and improve. Impact of licensing and regulation on hospital work process. The main purpose of licensing and regulatory requirement is to protect the safety of everyone at the hospital. That can be patients, visitors, staff and the environment. Where you find license are more giving a confirmation actually whether these regulations and accreditations are really better or not. So these rules make sure the buildings, the staff, the equipment and every all other things which are there in the hospitals or healthcare organization meet that the required specification they need to read. So it can be first seen as a building safety where you find that the safety equipments are like emergency exit, fire escape stairs, fire alarms and firefighting tools are at proper setted and they are being found to be very safe for the people. So then and then they can be given as a licensure and you find a lot of incidents which are growing are now only because they are not being licensed properly. The hospitals have not met those or they have not updated them actually for that part. So dangerous and infected waste is thrown always correctly and the hospital follows the rules for pollution control board which is very important and we find they abide the laws. The hospital has access to safe drinking water and electricity, which is a very important part where it comes to a major patient safety issues. Then comes that the items that can catch easily fire. They are stored in the right places and not kept open or access actually to common people. All generators are checked for smokes and fumes, emissions, and water and air samples are regularly tested whether they are clean and are potable or are able actually to be used by the hospital for their processes. Drug storage areas are inspected before the hospital can get a license under the Narcotics and Psychotropic Drug Control Act, which is very important to be seen as an important activity by the hospital. The process for getting rid of the old drugs is watched and reports are sent regularly to keep updated. That is very important part the hospital needs to see on. What is the responsibility that the healthcare profession should take? Doctors, nurses, pharmacists must officially registered with the correct councils and board before they come up for work. You cannot hire a person in the hospital like what they are not registered to their entity body. Since the health is controlled by state government, the state government must follow both central and state registration rules. Where an employee who is being hired needs to fulfill the requirement both from the state as well as from the central registration bodies. With respect to equipment safety, if the hospital uses X-ray equipment, just like in the Department of Radiology, the AERB, that is the Atomic Energy Regulatory Board, needs to check that all the safety measures are in place. Without that, it cannot really work being seen from the X-ray equipment, the room layout, the protective gloves, the PPE, to keep the patients, the visitors, and even the hospital staff that they are being safe, where you find that they don't encounter any safety issues. All the medical machines are checked and adjusted, where we find the calibration parts are often as a requirement that needs to be fulfilled as. So in summary to this chapter, I would like to emphasize more on that licensure is a mandatory government regulation. All your organization, hospitals or working places are to be fulfilled with this requirement. And it is an official authorization which is essential for legal operations. Otherwise, your organization will face legal suits. They will come up with litigations which are filed when you come across any patient safety issue, or it can be highlighted by any patient or patient's relative. It establishes the foundation, legal requirements and minimum standard that must be met, and it is for the government agencies actually and the state government particularly to see and inspect the hospitals for these processes. We should not wait that their incident happens or it should come from any media channels. So accreditation or certification is a voluntary process where the hospitals can go, they can welcome actually that they can seek this accreditation or certification that recognizes a professional or facility for achieving high standards. If the hospital tries to go for high standards, they need to go for accreditation. They need to have certification and then define that the benefits are that they are adhering to the specific operation rules. They get more benefit for that part. It entirely changes the image and the trust of the hospitals. A license is issued by a government body after the application meets the minimum health and safety standards, when often it includes an on-site inspection, where versus the accreditation is granted by an independent accreditation body. It is not nearly necessary that it comes from a government body. Licensing typically focuses on checking the basic infrastructure, whether they have met or not, and a limited number of processes. That in contrast, accreditation involves a comprehensive review, infrastructure, processes and outcome. So you may find what is there in licensing, what is there in regulation and what is there in certification. So licenses can be organized for facilities such as hospitals, where you can work on actually to help those that what are the minimum requirements, or an individual where you're hiring actually the people for your healthcare or hospital, where particularly the doctors, drivers, nurses and all other staffs are granted that after testing, after they seek that they have met the license, that they can be granted for the particular skills. So certification for the individuals requires specific education, training and experiences. Then and then only they can receive the certification. They need to successfully pass for that exam. They need to continuously fulfill on the ongoing requirements for such further courses where they can work on actually to take the education. The process to achieve accreditation involves a structured approach. It can include gap analysis, action roadmap, mock survey, and a final survey conducted by an agency audit. So this is the entire process which goes step by step. If the hospital has a team actually which is well developed to work on this, definitely it helps actually to meet the requirement of accreditation. So everything is possible to be achieved. It is only that the hospital needs to develop an attitude to work on the motivation parts for their employee, to give us support by the higher leadership that the hospital is going for accreditation. Also, they are mandated through the payment of regular fees or passing specific periodic inspection. Accreditation, however, requires a regular evaluation and has a defined expiry date. So you find accreditation organization must consistently submit performance data and report significant incidences like sentinel events or ADR. They need to complete with entire root cause analysis, which gives them what is the reason they have done it actually, that they have come across with this incident. It can be through a fishbone diagram or it can be through a Nishikawa diagram, and then they need to work on the preventive plan for that. So accreditation can streamline the licensing procedure. It can help actually to get a license more properly, because as a regulatory authority may waive the standard mandatory inspections for facilities that are already accredited. So the agencies will find that if at all we have to give a licenses, if at all the facility is accredited, they find that it can be used actually to get the benefits of this. And your hospitals can work on actually for all these things when they have a standard team actually, which is working for that part, and dedicated people actually who needs to fulfill all this requirement and can take this task as a mandate task rather than not an optional task for that part. So now at the end, I would like to emphasize that these are the references that you can work on actually if your hospital or your facility is taking any project actually which emphasizes to give you more for working on regulation, accreditation or licensing or even on certification. Thank you very much.